We are talking about tummy tuck scars today. A lot of women and men who have excess skin in their lower abdomen come to us for something called as tummy tuck or abdominoplasty. But they have this concern that how long or how big will the scars be. Hi, I'm Dr. Gupta. I'm a board certified plastic surgeon working in Delhi, and today we will be talking about one essential aspect of tummy tuck. So in case you are interested in the surgery, please watch this video and I'm sure you will benefit a lot. So there is one scar in tummy tuck which is long horizontal scar kept very low. Now this is important because we ensure that the scars are kept low as possible, just along your pubic hair line, so that they are not visible even if you are wearing a very thin undergarment. Now the scars for females are slightly curved up because that's the kind of design the female undergarments are, and the scars for male are slightly more horizontal because that's how the design of their undergarments are. So male's undergarments are straighter, female undergarments are slightly curvy, so we make sure that the incision also follows that path. The other important aspect is when we keep the incision low, we also ensure that we get a Mons lift. Now a lot of men and women may have excess pubic skin and saggy pubic area, so we also lift that up. So that's also a part of tummy tuck procedure. And third aspect which many men and women want to know, how long will be the scar. Now understand that does not depend upon the surgeon, it depends upon you, how your anatomy is, how the fall of skin is. Now if some person has just a central kind of paunch, we remove that excess skin and the scar is smaller. But if some women or men have this excess skin going up to the ASIS, which is the pelvic bone, the scar will have to extend that. In fact, in some patients who have lost a lot of weight would have sagging in the flanks, so that the scar may have to be taken up to there to get an extended abdominoplasty. I always tell my patients that don't worry about the length of scar. You will not have any pain in the scars because the way we do it, we give analgesia, anesthesia injections in the scar as well, so patients have no pain. Yes, they are concerned about the scar because they don't like unsightly big scars. But please understand, if your skin excess is that much, your scars will have to be extended. In fact, if you try to keep the scar lower and your skin excess is beyond that, then the skin goes up like a muffin top over it. It does not look nice. So understand, it is how your anatomy is, how God has built you, how much excess skin you have, in what extent the skin excess is, what direction the skin excess is, that decides about the length of the scar. But whatever the scar is, we make sure it is kept low and hidden. Now other than that, we also make sure that the scar remains very fine. Now in earlier ages, the scar used to have something called as tram tack appearance or a railway track appearance. The modern surgery does not have that. We have one straight line, we use absorbable stitch which is straight putted there, and we always use something called as quill sutures or stratafix, so you can research about them. What it does, it binds the scar in for a longer time so that the scar does not spread. So neither they have a triumph appearance, neither are scars spread wide, they remain fine. And then once the surgery is done, after a few weeks we'll give you certain silicone gels and gel sheets to put on the scar and massage the scar so that the scar heals very nice. In fact, if someone is too concerned about scars, I also tell them that after 4 to 5 weeks, they can also go for lasers and the scars then fade. So mind you, none of our tummy tuck patients has come back to us that they are unhappy about the scars. None of them say they regret the scars. All of them say that their only regret is why did not they do this surgery earlier. So scars are not bad because the way we do it, it's always hidden, kept very low. But the results which you get after tummy tuck or abdominoplasty are really nice and it's well worth it. Thank you.